Sex and Sexuality and Advanced Illness. We are talking to you today about sex and sexuality and advanced illness. We will use the term advanced illness and cancer interchangeably. As an illness advances, it continues to affect your mind and body in different ways. These changes can come up suddenly and intensely, or it may be a more slow and gradual change in how your body functions and how you feel about your body. However the changes happen, it is one of the many things that you and your loved ones have to adjust to when you're dealing with cancer. As you watch this video, keep that in mind and hear and reflect on the information that identifies with your experience. Our sexuality and how we define ourselves as sexual beings is an important part of who we are, even as a cancer diagnosis comes and our illness advances. Sex, sexual function, and sexuality are part of our relationships and who we are. So it's important to talk about how you can continue to address your need for sex, intimacy, and personal contact. This video will talk about what you and your loved ones can do to continue a sense of connection as your illness or cancer advances. We would like to tell you that these are common concerns for people in advanced illness, but not common conversations, so they can be hard to talk about. We want you to know there are some things that you can do to manage the changes that advanced illness and cancer bring. We're going to talk about some of the challenges and then talk about what you can do about it. First, let's talk about the challenges. It's not part of the care provider's assessment. Your weight, intake, output, temperature, medications, pain, and a number of other things are asked of you each time you talk with one of your care providers. You often are not asked, how has your relationship changed, or how has your sexual function suffered as a result of your cancer or illness? When we're asked other personal things and not about intimacy, we tend to think that it must not be important or that we shouldn't bring it up because the care provider doesn't. The treatments have changed your body and how you feel about it. Whether you've had surgery, radiation, chemo, hormone therapy, or your illness has continued to progress, they all have an impact on your mind, your body, and how you feel about it. You may have scars, more weight, less weight, or just don't feel or look like yourself. A lot of people who have had cancer don't feel like they will ever be the same again. Your sexual parts don't work like they used to, and intercourse may hurt. Medication changes to your body, and treatments change how you feel. It can change the way breasts feel, the way penises work, and how comfortable intercourse feels for a vagina. Advanced illness and cancer affect how we feel, perform, and function. Men may have difficulty with erectile function, which often leads to less hugging, kissing, and touching with the partner. They don't want to start something that they can't finish. Surgery and radiation cause changes to the vagina, which may make penetration difficult or painful. You're not sure how your partner is feeling and whether they are missing the intimacy too. There are so many things that you've had to adapt to, either individually or as a couple, from the insult that advanced illness and cancer bring. Some partners pull away because they don't want to pressure or seem insensitive if they express their need for intimacy and/or sexual release. The person who is experiencing the changes to their body may struggle with whether they are still desirable and interpret the pulling away as confirmation that their partner does not find them attractive. Lack of privacy. In general, acute care hospitals, palliative care units, and hospices have not been set up to promote intimacy and sexuality. Most of us have kept what happens in the bedroom. Now you may be living in the bedroom pretty much full time with a revolving door of people coming in and out. There may be care routines, call bells, staff and visitors coming in at regular and seemingly unpredictable times. Even if you're at home, you may have several care providers coming in a day and your routine becomes focused on personal care, medications, and eating. As a partner, you're doing a lot of caregiving tasks and it's hard to think about your loved one in a sexual way. There are many insults and adjustments to one's dignity as an illness impacts a person's body. Participating in bowel or bladder care can make it hard to think about these parts as also a source of pleasure and intimacy. You don't have a partner, and no one brings up that sex may be important to you. You may wonder how to have, be, or enter into a sexual relationship after a diagnosis. It may not seem like others think this is a priority for you. Sex feels like too much work. Advanced illness takes a lot of energy and causes fatigue for both the person experiencing the illness and the partner who's doing the caring. You may also experience shortness of breath or other symptoms when you increase your activity. If you're experiencing one or any of these challenges above, you're like the majority of people living with advanced illness. Chances are that throughout your illness, most of your care providers have not asked you how you're feeling about these changes or address what you can do about it. Our hope is that this video will help not just you, but will also start to create some change in the care that all people with an advanced cancer illness receive. Now let's talk about some things you can do about it. Talk to each other. If you're missing what you used to have as a couple, chances are your partner is too. Let your partner know that you still love them and are in love with them, and discuss your feelings such as sadness or anger that the illness has caused changes in your relationship. A lot of people who get cancer feel guilty that they brought this to the relationship or the family. Let them know that it's not their fault and that you don't blame them for the place you find yourselves. Talk to your healthcare provider. There are a lot of things that can be done to help an individual or couple maintain or improve intimacy. If your healthcare provider doesn't know, they might be able to direct you to resources or connect you to other supports. Check out the resources on the screen from Dr. Ann Katz for more information and ideas on addressing sexual needs and specific strategies for maintaining intimacy. We will list the resources again at the end of the video. Create privacy. It's okay to block time in the caregiving schedule for you to enjoy pleasure, either with yourself or with your partner. You may have to be assertive with your hospital or home care providers that this is something that is important to you and seek their help to block the time. Maybe it's posting a "Do Not Disturb" sign outside your door to let your care providers know that you need some personal time. You can get creative in what that sign can look like. Maybe it's a picture, maybe it's words, and then letting your care providers know that when the sign is up, it's personal or couple pleasure time. It may feel like this means less spontaneity, and you may not feel like actually engaging in any sexual activity during that time. That's okay. It's about affirming it's important and using the time for yourself or to connect with your partner in whatever way works for you. Explore options to improve function. Like other parts of our bodies, our sexual parts work better when they are regularly used or exercised. Our vaginas and penises work best when there's regular stimulation and increased blood flow to the areas. Whether you call it stimulation or masturbation, it's one of the simplest ways to start improving your sexual function and doesn't require a partner. Doing Kegels can help with continence and sexual function by exercising the muscles that are involved in sexual activity. For men, there are a number of options to improve erectile function that can include injections, medications, and implants. We encourage you to talk to your doctor or nurse about these and other options. Good sexual intimacy doesn't necessarily have to start with desire. For women, you likely have very little desire or interest. Feeling comfortable with your body, having had good sexual experiences, and a willingness to be open to future good sexual experiences is probably the starting point. Maybe you start by having your own little way of opening yourself up to engaging in sexual intimacy. Maybe you do your makeup in a particular way or wear certain underclothes or clothes that make you feel like you would be open to something happening. Using vaginal moisturizers and lubricants and engaging in masturbation, penetrative sex, or using a dilator or vibrator on a regular basis are ways that you can keep the vaginal tissues healthy and continue to enjoy sexual activity. If pain or shortness of breath is an issue, consider talking to your healthcare provider about medications that can help and how to use them. If you have an ostomy and worry about leakage or smell, you can consider emptying the ostomy before intimacy, using candles, aromatherapy, and wearing something over the bag that makes you feel confident and comfortable. There are websites that sell lingerie specifically for those with ostomies. Engage your resources. There are professionals that specialize in different aspects of the way our bodies function. Your healthcare provider could refer you to a urologist, gynecologist, and/or sex therapist if you feel that you need more than the above information provides. There are pelvic floor physiotherapists who can help specifically with continence issues and vaginal discomfort. Occupational therapists have training to help with positioning if it's difficult for you or your partner to physically connect in sexual positions on your own. Not all of these resources are covered by OHIP, and you may be required to pay for some of these services. Find what works for you. There is no one solution that is going to work for everyone. You may decide that intercourse just isn't something that is doable or important to you as an individual or couple anymore. That's okay. There are many other ways to be intimate. What makes you and your partner feel connected? Is it looking through pictures of your life together and remembering some of the better times? Is it just being intentional when you have moments of touching and appreciating that you had this time and opportunity? If pain and discomfort isn't an issue, can you join your partner in the bed and just hold each other? Maybe you have clothes for caregiving that you put on when you're doing personal care and wear something else when you're not doing caregiving to separate the roles and maintain intimacy that way. Is it taking pride in preventing bed sores and relishing the touch as you sponge bathe your partner? There isn't a right or wrong. It's really about finding what works for you. We hope that you have found this video helpful. It is our hope that you know that you are not alone in having these concerns and that there are some things that you can do to maintain your sense of connection and intimacy with yourself and your loved ones.